When a massive natural disaster strikes a coastline, leveling infrastructure and displacing thousands, the public instinct is the same. Send in foreign medical teams. We picture heroic doctors parachuting into the rubble to set up field hospitals. But an experienced trauma surgeon standing in a disaster zone without electricity, sterile tools, anesthesia, or insulin is largely powerless. Medical expertise requires physical material to function. The actual primary cause of preventable mortality following a disaster is supply chain failure. A manufacturing hub could have thousands of doses of antibiotics ready, but if the logistical line breaks down at the impact zone, people die. Surviving a global crisis rarely comes down to a shortage of doctors. It is a brutal, unforgiving problem of physical logistics. That logistical bottleneck is the sole focus of direct relief. Based in California, it operates at a scale rivaling many government agencies and currently stands as the 5th largest charity in the United States. They employ 0 frontline doctors. They do not run hospitals. They perform 0 medical interventions. Instead, they operate an invisible, highly efficient, $16 billion medical supply chain that spans across 136 countries. By completely removing the urge to fly in foreign personnel, they channel 100% of their resources into moving pallets of medication and equipment through damaged infrastructure. Direct Relief's entire operation runs on an in-kind economic model. Rather than relying solely on cash donations to buy medicine at retail prices, they partner directly with pharmaceutical companies who donate massive surpluses of their physical inventory. Look at this visualization of their financial leverage. Because the physical products are donated, a single dollar of operational overhead delivers many times its own value in wholesale medicine to a local clinic. Their inventory includes highly regulated, fragile products, ranging from temperature-sensitive oncology drugs to millions of doses of naloxone to combat domestic opiate overdoses. This procurement model effectively transforms idle corporate surplus into a privately funded humanitarian treasury, free from the delays of government bureaucracy. To manage that volume of regulated pharmaceuticals globally, traditional nonprofit methods wouldn't work. They realized they needed the infrastructure of a Fortune 500 company. This wireframe demonstrates their adoption of SAP, an enterprise inventory software tracking batch numbers and expiration dates with pinpoint accuracy. This corporate rigor allowed Direct Relief to become the first charity licensed to distribute prescription drugs across all 50 U.S. states. Navigating state-by-state pharmaceutical compliance requires mirroring the rigid, exacting mechanics of corporate capitalism. It is the only way to move controlled substances safely at a global scale. Instead of pushing unrequested supplies into a disaster zone and hoping they are useful, Direct Relief uses a pull-based distribution model. Local clinics log into a digital network and order exactly what they need, eliminating waste. They also use predictive modeling to anticipate needs. Days before a major storm makes landfall, they assemble and pre-position hurricane prep packs containing specific emergency medicines directly into the storm's path. When immediate transit is required, they activate partnerships with logistics giants like FedEx to load tons of medical aid onto charter planes, bypassing administrative delays. This pipeline ensures that when a local health system is pushed to the brink of collapse, the right medicine reaches the exact right clinic at the precise moment demand spikes. The efficacy of this model is highly measurable. Independent evaluators like Charity Navigator have awarded Direct Relief a perfect 100% rating for 15 consecutive years. Domestically, they have injected over $2 billion in donated medicine directly into the U.S. healthcare safety net, supplying thousands of local free clinics and community health centers. Internationally, their reach extends into the most volatile environments on Earth. They have successfully routed over $1.5 billion in medical aid directly into active war zones, including Ukraine. These metrics demonstrate that prioritizing logistical precision ensures humanitarian resources are not just promised, but physically delivered to those in the greatest need. Slowing down, reflective. Parachuting foreign doctors into a crisis often disrupts the local health systems already trying to function. Direct Relief's model is built to empower the community that is already there. It is an approach rooted in humility. They operate as the invisible infrastructure, handing local heroes the exact tools they need to save their own neighborhoods. True humanitarian aid rarely looks like a dramatic rescue. Most often, it is just the relentless, unglamorous precision of a cardboard box